Okay. Rolling.
Welcome to Pharmacist Corner, your local resource for all things pharmacy. Today my name is Matt and I'm here with my fellow pharmacists, Catherine, Jenny, and Parita to further discuss blood glucose monitoring and basically its effects on the body. What I'd like to do today is start and tell you a little bit about your blood sugar or blood glucose and how individuals who have type 1 or type 2 diabetes need to monitor this on a regular basis in order to comply with therapeutic goals and outcomes that they've set with their primary care physicians. What I'd also like to do is further discuss with you a lancing device. This lancing device is used to actually obtain your blood sample, and what you need to do to operate this is you'll first of all, remove the cap from the device, at which point you'll take a drum which contains the lancets in it that you'll use on your finger to obtain your blood sample. And what you'll do is you'll insert the blue end of the drum into the lancing device, and you'll hear it click. I'm not going to insert it as of now because I don't want to prick myself at this point. But what you'll do is you'll insert that until you hear it click, at which point you can take this device and what you can do is adjust this gauge here. Some individuals have more calluses on their hands than others, and so you can adjust the depth at which the needle or the lancet actually plunges into the skin. And so at which point you will prime the device as so, and you'll hear it click, and this yellow indicator lights up, indicating that it's ready to be used at this point. And what you'll do is you'll set this aside at this point while Parita tells you a little bit more about getting your blood sample, as well as Jenny will discuss further what you're going to do with your blood glucose monitor. And in this regard, at which point you'll take your device to the side of your finger after you've washed your hands and press the button, and you'll hear it click as you actually receive your blood sample. So Parita, if you could go ahead and describe what we do next. Thank you.
Sure. Now that we all know how to set up this lancing device like the way he told us or showed us how to do, thank you very much for doing that. Before we even start taking a blood sample, we want to wash our hands with water and soap. After we wash our hands, the patient, it's person to person, you want to first decide which finger of your hand you want to use to get the blood sample from. The reason why we use the fingers of our hand is because our fingers has the maximum amount of blood flowing or circulating in like other than any part of our body. So if we decide first of all to use this finger, you want to first milk your finger or squeeze your finger for a few seconds before you use the lancing device to get the blood sample. So you pick your finger like this for a few seconds, and then once you see all red on the tip over here, it's probably ready to get a blood sample out. You don't want to pinch yourself in the center or on the tip because that's the most sensitive part where your nerve endings are, so it would hurt more. So you want to select like a lateral side of your finger to get the blood sample. When you hold this lancet like this, and if it's all set up with your gauge setting, it's all ready. So you just click like this, which I'm not going to do at this point, and get the blood sample. And as soon as you click there, you squeeze a little bit more to get like a drop or two drop of blood out, and then you can go to your device and touch your blood to the test strips tip, which is a yellow tip of your test strips, which Jenny would explain you further to get the reading. I'll pass on to her now.
Okay, before I get the blood drop from the perimeter, I will wash and dry my hand and get the one test strip from the container. After you get one, just close the container tightly and insert the test strip into the machine in the direction of the arrow on the test strip. And you will see the meter is turned on. And make sure the code display on the screen is match the code on the test strip container. If you didn't see the code display on the screen, just take the test strip out and reinsert it again. And when the blood drop flash, you can get the put the blood drop into the test strip. The way you put the blood drop on the test strip by to turn the blood drop on the tip of the yellow window of the test strip. Do not put the blood on the top of the test strip. And you can see the flash on the display on the screen. If you didn't see the result on the screen, it means you don't have enough blood. So just apply more blood on the test strip in 5 seconds, and you will get the result. And now the Catherine will show you how to dispose the supply.
Okay, thank you, Jenny. So lastly, I'm going to talk about the appropriate disposal of supplies. First off, you're going to dispose of your Lancets in a closed plastic container. So what's normally recommended is a sharps container, and this is what it looks like. And you can usually find this in any local pharmacy for a fairly cheap price. However, if you can't get access to a sharps container, other options you have are just empty soda or water bottles, or even like an empty laundry detergent bottle. Anything that is puncture resistant and anything that you can make sure you have closed. And after your sharps container is about 3/4 of the way full, make sure you tightly seal it, or you can tape it as well, and make sure that nothing falls out, because that's really dangerous. And also, another word of advice, make sure you never put your hand into a sharps container, because you can easily hurt yourself. And for anything else that is contaminated with blood, such as like your gloves or cotton balls or Band-Aids, you're going to dispose it properly in a biohazard container or bag, like so. And everything else that is not contaminated by blood or any Lancets that go in your sharp container can go in your regular trash. And to dispose of everything else, after you want to properly dispose of everything, then you can contact your pharmacy and they can help dispose everything for you, or you can contact your local trash agency and they can give you the different options to properly dispose of everything. And now that you know how to correctly read and use a glucometer, good luck on your future glucose readings and testings. And if you have any questions, please do not hesitate to contact all of us at pharmacists@sullivan.edu. Thank you for joining us and have a great day.
Thanks. Bye-bye.